Start recording. Thank you. Now let's have a look what we have been discussed today. So I sent this exercise for you through my class message this morning already. So just have a look. Any concern for week 1 contents? Have you chosen a Western disease for your topic yet? What have you known from the tongue presentation last week in the class? What is the physiology or pathology of the person? Can the tongue presentation guide the correct directions for your final CM diagnosis or further consultation? Can you elaborate it? So I'll leave the question for you. If you have any concern, you can ask me in the class in the session or send the question for me through my class email. It's up to you. So welcome any kind of concern regarding these kind of questions so we can learn through each other's questions of concern. Now, what we've been discussed today is basically we compared some of the concept, warming heat, damp heat in Wenbing, treatment principle, warm heat, damp, and damp heat warms, or maybe I missed something. Compare the difference between Shanghai and Wenbing regarding to etiologies, pathologies, and treatment. Indicated importance, discuss basic concept of 4 levels as well as triple burner. And mention some major differentiation patterns within the 4 levels and the triple burner concept. And for following part, we're going to have some basic review for today's concept, and it's going to do some very basic case study. So what means warm heat disease? So from this slide, it tells us warm, which is very quick onset and transmission illness, and has covered various different changes in the conditions. Heat signs usually more dominated in the basic clinical manifestations, which is very easy associated with body yin and fluid damage at the same time due to yang in natures of heat. Example of warm heat conditions, so they can affect the heart very easily if the spirit and mind has been affected, especially the conscious level has been altered, and if the bleeding has been presented, it can causing damage in blood vessel, and it also can causing convulsions if temperature is so high, so liver also can be affected by wind heat conditions. In general, heat conditions involve the fever, red complexion of faces, and the concentrated urinations or dried or constipations involved, and very red tongue presentations, and maybe coating color change into yellow or rapid pulses. So, and at the same time, they have to have associated with body fluid injury. So with combination of both, general heat signs, body fluid injuries will complete basic clinical manifestations of Wenbing for the clinical suffering. When affected different level, so relevant different levels body fluid will be affected. If it's V level, nothing will be damaged because very gentle. If the Qi level, lung yin, stomach yin could be affected. If it's neutral level and liver blood, kidney yin in some level affected. If blood level, liver blood, kidney jing will be affected. If in the upper gel, in the surface, nothing yin will be damaged. If in the upper gel Qi level, lung yin will be affected. And if it go to the upper gel lung organ, lung yin definitely will be affected. And if they go to middle gel, stomach yin will be affected. If you go to lower gel, liver yin, liver blood, and kidney yin, kidney jing will be affected. So either using 4-level differential diagnosis or triple burner differential diagnosis, and depends on which pattern, and associated body fluid will be injured based on heat dominant pathogens in Wenbing. And damp heat accumulations, I'll may leave you for self or for study for this one. I just want to mention one thing about some of the informations I translated through. One is very good and Chinese lectures, so this is give you additional informations to understanding specific clinical manifestations, and with proper explanations covered, which I did some interpretations. If you find it can help you understanding why this kind of symptom comes through, read it through. If they find it's too complicated, easy, leave it free or delete it. So example here, and what means slow pulses representing damp heat disease. So dampness restrict the qi and blood flow in the vessels, and heat unable to invigorate flow. So that's why in the heat, damp, passage caused conditions, you could have slow pulses. So this explanation help us review some pathology and to consolidate some diagnosis abilities. So this part of argument, part of the explanations, will help you to complete, to answer some doubt. So I'll leave you read it for itself. Is that okay? If you have any question, you can always raise hands. Thank you. Now, second part, thank you. Second part of damp heat disease here talking about, okay, first part here mentioned of heat accumulated in the dampness. So what will happen for the clinical manifestations? Second is talking about dysfunctioning of transformation and transportation of the middle gel. So because the damp is a part of pathogens, what will be happening for the middle earth? So here I have a list what will be happening regarding to possible clinical manifestations. And most of that, we learned that a lot. I posted already. I put in my class message. Thank you. Yeah, thanks. Sorry, the reason I put in my class message is I'm happy sharing with all of you. And I don't want this information to be utilized by the others, have never had to do any study and just can put it into someone else's for fun, so which is not fair. I know knowledge should be shared, should be no border, but you need to have some work on that and able to understand it. So it's my naughty part for jealous, isn't it? Okay, number third part regarding damp heat disease is abnormal water metabolism, which involves triple burner and which involve prolonged illness because the dampness is in nature, which is very easy to present as a sticky, lingering nature and very, very commonly presented as a kind of intermingled pathogens with heat, with cold, with damp, with wind, depends clinical manifestations. So once any kind of the illness related have some level involved by the damp, usually recovering time take a longer time than any kind of illness without the damp involved. So damp is very, very lazy and very, very difficult pathogen to be cleaned out specifically. So that means most of latent pathogens in some level involve damp or embedded into damp environment. And there's specific note regarding to principle treatment for the warm heat disease. And it's very important to understanding different level of the heat in 4 level, different level of damp heat in triple burner. Treatment have specific focusing. So example is for pathogens in the V level, you need using diaphoretic, clear the heat, expel the pathogens and as soon as possible. But for the heat interior, clear and drain the heat and release through something downwards draining method or herbs. But for the heat and nutritive level, blood level, you need to clear the heat and from both nutritive blood level by apply cooling, sweet and salty herbs in conjunction with cold and bitter one to protect further damage of body fluid or yin. But if any kind of yin injury has been presented in the clinical manifestations, you have to apply the yin tonified method to supply the body fluid to rehydrate the bodies. But with damp heat related triple burner disorder, bitter, warming, and bitter cold combination herbs will be necessary to resolve this kind of damp heat dominant pathogens. Depends damp dominated or heat dominated, so different ratio of warming cooled nature herbs will be used in conjunction with other damp heat clearing herbs or method as well. And here's a slide with the tables to indicate specific comparison between Wenbing and the Sanghan. And Sanghan is a focus on cold governs cold pathogens. So as a cold in nature, which governs contractions Our body attracted by external, any kind of cold dominant pathogens, interstitial, so basic gaps between the skins or tissues of the muscles, and will be constrained to protect the body. So that's why cold signs is more severe and pain will be dominated. At the same time, the passengers does not have a strong mobility in cold natures. The enter the interiors takes a bit of time, usually about 1 week in Shanghai discussions. So if the external pathogen cannot be resolved within 7 days, usually partially go to the Shaoyang or partially go to other levels. So they're very slow, very gentle. That takes time to progress. Very gentle, like gentlemen. But the warm pathogen is different. And warm pathogen is young in nature, very aggressive, like a little puppy. They can opening and dispersing. They have opening, dispersing natures, and they can penetrating the bodies, have very quick onset, and go through the system very, very quickly. So they may still can opening interstitial space of the skin and the muscles. They also enter straight away through the nose and the mouth. And the pathogen penetrate very, very fast. And temperature elevated very, very quick as well. They can affect various organs, depends on progression, depends on the strength of pathogens. And here I have a questions. For Wenbing, is it possible to stay in wheel level for 1 week? It's impossible. Wenbing is not possible to stay in the wheel level for 1 week. Either they're going to change from wind heat become wind cold due to internal yang deficiency, from wind heat in surface go to heat in the qi level. So they have to change. Yes. Why did they put a dog there? It's nice, cute dog. And questions here, I'll leave you for self-study. It's very easy. And if you understand it, just put this kind of answer. So this is the answer. And into correlated brackets. Okay. Same, this is also answer. We're all very intelligent. And same for the comparison. This slide is just a review we discussed. And in today's concept, we can have it fun, spend a few times to complete the whole information there. And same for the specific difference between the narrow concept Shanghai and basic concept Wenbing. You need to have very well understanding for these slides. It's very important. So I'll leave you for self-study. Self-completion, sorry. And theory presenting Shanghai, theory presenting the Wenbing slide different. So in Shanghai, we focus on 6 division differential diagnosis. In Wenbing, we focus on 4 levels and Sanjiao differential diagnosis. In Shanghai, we emphasize on the yang qi protections or yang qi transformations through the portal concept, emphasize the importance of qi dynamic in the body, and strongly link the Yi Jing concept and the 5 element theories, identify the disease or being and connect with divisions, and instead the syndrome originated. But for the Wenbing, we focus on the qi and blood activities or their wax and wanes in the bodies, and specifically focus on the in-depth understanding for damp heat pathogens influence in the Sanjiao differential diagnosis. And in the Wenbing concept, we focus on strongly linked to the Zhangfu organ theories. A lot of patterns you find the Zhangfu organs, such as today's upper gel, we're talking about the lung heat. So in the lung organs, that's an organ differential diagnosis, mainly using syndrome differential diagnosis. So these 2 parts you can have review if you want it. Wenbing and the Wenyi, and this we discussed in week 1. So Wenbing is non-epidemic warm disease. Wenyi is more what? Epidemic. It ages very badly. And Wenbing is epidemic warm illness, but Wenyi is very strong pathogens. You cannot actually stop it in a very short term. They are very contagious, prevalent, and can cause in big population have similar sufferings. Now, comparison between Wenbing and the Wendu. And Wenbing is basically broad concept of warm disease. So anybody suffering any illness with fever dominated, we call the Wenbing. But the Wendu is focused more localized and have a swollen, pus-like, very red, hot to touch, very painful. So these answers here in the bracket, you can have it fun to do self-completion for this exercise, and which we discussed in week 1. Differential theories using Wenbing. So this we discussed and consolidate today about 4 levels. And these 4 levels concept we learn in diagnosis, in pathology. So today is the 3rd time we discuss these kind of theories from different perspectives. And this specific concept originated from Ye Tianshi, and he basically created and constructed 4 complete theories about 4 levels differential diagnosis in Qing dynasties, and which is specific further development for the broad concept of Shanghan. And overall, the Wenbing or in the 4 levels is emphasized on what differential diagnosis and Wenbing focus on qi and blood, yin and yang. So qi is more yang, blood is more yin, specific for these 2 parts of components discussions. Now, just to review a little bit, what means a qi in some way. So either qi here you learn from zhen qi, yuan qi, or zhen yuan zhi qi, or gu qi, or prenatal qi, postnatal qi, natural qi. So basically, when we're talking about the whole body's qi, which is equal to zhang organs, jingluo's qi, so it's a kind of functionality in some way. We discuss a lot about this. So which is kind of functionalities of organs, or components of blood streams, and specific protections of the bodies. So using very broad concepts that keep it simple. Here's a basic comparison between zhongqi, yuan qi, wei qi, and yin qi. You learn this in class. And here, only want to know is when the qi becomes sick, exterior heat pathogens cause the dysfunction of zhangfu and the channels in the body will be occurred. And qi disease and equivalent to the Wi levels conditions plus additional qi levels illness. So that means when the qi level, Wi level become disorder, it's all qi disease. They don't have structure changes. They can left behind with no scars, no serious damage, no damage can be recorded. But the qi illness cannot be resolved. Further deteriorations go to blood levels conditions, and then they become serious because blood levels conditions, the blood levels disorders, they are going to have what? They affect constitution of the blood, circulation of blood streams, and then affect individual organs of the heart, of the liver or kidney or lung or any of these kinds of structures. So they are going to have structure changes. So any kind of nutritive level or blood level disorder, we call that blood disease. It's a blood disease. Now, in these slides, I mentioned there are 2 kinds of disease happening in the blood in Wenbing. One is heat pathogens consume the blood liquid and result in thickness and stiffness of blood and even blood stasis. That's why we have slippery pulses in heat conditions as well. Second is heat pathogens disturb the blood and causing bleeding. So one is the blood still within the bloodstream, but they get more concentrated, sticky. Second is the blood not just concentrated, be concentrated, also leaking out, change the permeability of blood vessel leaking out, become bleeding. So for the bleeding, for the blood disease, what is only happened within the blood vessel, we call it level disorder. When the blood leaking out of blood vessel, we call that blood level disorder. So that's why using these 2 basic concepts, qi disease or blood disease, to summarize the difference between Wei qi level disorder and yin and blood level disorder. Now, further differentiation in the 4 levels of Wei, Yin, Wei, or 2 stages of qi and blood. Here mentioned stage of dysfunctioning In the Qi level, is basic dysfunctioning presented in the organs and or possible defensive systems. So either Qi level, Wei level, but the stages of the structure changes or nutritional injury, and they're presented in nutritive level or blood level. So this, we mentioned that in the previous few slides, is similar, just summarize it. And here's a give you self-exercise by previous informations, which is very easy filled in. It's a Wei level condition, Qi level conditions, or 4 level condition. So which is what? Warming heat pathogens attack the surface of the body and causing dysfunctioning of the lungs' defensive function. So only dysfunction, not serious organ damage, leading to the lung failed to descending disperse. So fever around da. So which level? We know is which level condition? Wei level. Thank you very much. Based on the basic conditions, we know is in the channel, and absent sweating, slight sweating, da is a typical Wei level condition. Yes. And there's a question, is this cheeky exam hint of what sorts of questions, da. When I mention something you have to know, comparing Shanghai and Wenbin, yes, it's very important. That means a hint. Maybe present for the exam. Yes, thanks. It's good, very smart one. This is another part that tells you what? What's the difference? What's changed? In the Wei level, temperature usually not that high and have some level intolerance of cold together, but heat dominated. When the temperature is so high, above 39, there's no cold intolerance and only have heat intolerance with dehydrations. Because which level? Excellent, is Qi level, but still dysfunction of organs in some levels. So this is typical conditions, we know that one. How about here? They disturbed the heart shen. They have a hot, but which is worse at night, temperature 39 or 40, vexation, anxiety, delirious speech, nutritive level. Is that blood level? Any bleeding? Any bleeding? No bleeding, so it's nutritive level. Thank you very much. So no bleeding is nutritive level, yes. Good. But this now, any bleeding? Various bleeding here with hot bodies and crimson tongue bodies and rapid pulse. So it's blood level. Wonderful. So here just highlighted something important. We are able to differentiate difference for 4 level, Qi level, nutritive level, yin levels disorder caused by heat dominant pathogen in Wenbin. And depth and path of the illness in Wei Qi initial conditions for warm heat. So I'll leave you to connecting lines for fun. So give you 1 minute, have a go. Which one you're going to link it? External pathogens, Wei pattern, Qi pattern, yin pattern, blood pattern, concurrent Wei and Qi disease, interstitial heat in both Qi and nutritive level, interstitial heat in the Qi, yin, and blood level. So you need to make lines to connect it. So this one, is that right? And the rest I'll leave it for you to draw. Very simple. Even don't need the brain, you can make it out. So if this Qi, that means what? And the yin, is that correct? And the rest is Qi, yin. Good, good. Thank you very much. Thank you. Purple line. All right. Now, after 4 level differentiations, and just review a little bit for Sanjiao concept, and based on information given in the slides, 4 major concepts of Sanjiao has been presented since the Neijing, so internal classics in Yellow Emperors, and difficult issues of Nanjing. So in the difficult issues, they mentioned the Sanjiao is a passage for transporting yang qi. Sanjiao is a pathway for body fluid, and Sanjiao is outline for upper jiao, middle jiao, and lower jiao of 3 major parts of body. Sanjiao is one of the 4 organs which transporting and transforming nutrients. So this is from one of the classics. From modern concept, one of fascial systems indicated, and Sanjiao is a band or a sheet of connective tissue. It's called memory-like tissues, primarily collagen dominated as a kind of composition, and which is beneath the skin that attaches and stabilizes, encloses, and separates muscles and other internal organs. Fascia is classified by a layer or memories as a superficial fascia, deep fascia, and visceral or parietal fascia, or by its functions and anatomic locations. So details you can read through this link. And I'll send another link for you regarding to most recently free seminar has been organized by ACMA talking about the Sangios in the YouTubes. Okay, Jennifer, it's all right. Now, differential theory used in Wenbin. So here, basically, just a review what we discussed today. And this exercise, I'll leave you for self-study because all the answer here already provide. Just put one or another based on information given previously to put it on. And same for this one, draw a line, very simple. And same for this review, you need to make sure you're able to differentiate difference for this relative concept based on today's information, to review that, to consolidate the understanding. They're all covered in previous pathology and diagnosis. And summary of the Sanjiao here. Upper gel, middle gel, lower gel. This summarizes today's concept. So most important I need mention here. There's overlap between 4 levels and the Sanjiao in regarding to upper gel here. So you can see the mentioned V level, Qi level, they are overlapped concept of clinical manifestations. If in upper gel triple burner conditions affected pericardium, possible some nutritive level symptoms will come out, possibly both nutritive blood level symptoms comes out. There's a questions. If there's both these comes out, how I'm going to differential diagnosis? Don't worry, using one series and then others will be fine. But because clinically we are not able to see these conditions, that means that it's impossible to examine these conditions. But just tells you theoretically, clinically, there could be have a lot of overlap. Say for middle gel differential diagnosis conditions, they could cover Qi level conditions or both Qi and the nutritive level simultaneously, Qi and blood both levels and conditions in the middle gel burner differential diagnosis for damp heat conditions. And same for lower gel differential diagnosis, they could partially overlap with blood level and deficient symptoms covered in 4 level of blood level disorder conditions. They have lots of similarities. And this is very simple exercise, answers here. You just need to choose the correct one, put in a bracket. And same for this one, I'll leave you for self-study. This is try to compare the different models of theories we already learned so far for level, Sanjiao differential diagnosis, 6 division, and Zhangfu differential diagnosis. Zhangfu differential diagnosis is the most latest one to complete. And that's why Zhangfu differential diagnosis is much more easier for us to adapt. They have lots of similarities by using anatomy, physiologists, and organs, and it's easy to communicate with people doing non-TCM background. For the rest of others 3, it looks like more energetic involved and much more classic one. So you need to work it out answers very simply by itself. Now here comes a case study. We have to be able to go through case study to review the concept we learn in the class, to able to encourage to improve our differential diagnosis and consultation skills in the clinic, because most of us doing the clinic already or is going to be. Let's have a look. So what we'll be expecting for case study as a given manifestations in your head, identify warm heat worms or damp heat worms, autumn dry worms, etc., or maybe Shangheng conditions based on given symptoms and signs. Indicate the most likely etiologist or pathologist with the most suitable theory, and state a summary of the final diagnosis with 1 sentence. Provide a mirror image of treatment principle and name and formula with its moderated herbal groups. And if they require acupuncture points, do so. If not required, don't worry too much. Now, example, if this case is presented for the exam, that means this is a full case study and take about 20, 30 marks to complete. Each part, each area is required, like this, each condition required have different separate marks. So just have a try. Once any of you ready, you can put your information on the slides. 24 years female, comes to clinic in April. So if you're keen about season connections with pathogens, April in Australia is what season? Is it spring? Is it summer? Is it autumn? Is it winter? It's autumn. Thank you. So main complaint, fever with slightly chills, headache, and cough for 7 days. For 7 days. For 7 days. For 7 days. So background history is on March of 27th, the patient started to have headaches, a fever, and slight chills. So initially, the patient have what? Have Taiyang conditions or have level problems. Cough with profuse white sticky sputum, so which tells is typical what? Cold types pathogens involved based on initial complaint here. Also extension, feelings in chest, and poor appetite. Indicate Taiying both the lung and the spleen is not strong enough. So Taiying division has been weakening with external attack, cold weather changes. She has a dry nose. So that's a currently. That's after follow-up is currently. She has dry nose. There's a different color. And also thirst. So dry nose thirst is correlated with season of April here in Melbourne with a desire to drinking water. So there's some body fluid injury after this kind of suffering. The most importantly, this tells you what? Tongue coating, tongue color tells you it's not wind cold anymore, no matter which level. It's something already turned into heat level. With thin, greasy tongue coating, some dampness also comes out internally. Even they have no damp externally, internally due to weak spleen, because you can see previously is what? They have what? Cough with profuse sweat, is profused sputum, white sticky color, which indicates spleen and the lung is strong or weak with poor appetite. So they have precursor of weak, good. So weak lung Taiying, weak spleen qi. So very easy, have weak spleen, not able what? Have proper TT functions. With this kind of unresolved passage with further depleted spleen, that's why I have a greasy tongue coating now. And the pulse is still superficial, so you can tell something still has been resolved properly. At the same time, funny, slippery rapid. So this tells you what? Problem just in the V level. They also have something possibly affected what? Qi level or up gel and middle gel. Now, in what circumstances are we using 4 level? In which circumstances are we using triple burner? And why? So she has been diagnosed as a bronchitis by her Western doctors, so which typical one. The temperature is about 38.7. So based on current complaint is a Wenbing. We should use 4 level or triple burner differential diagnosis, and why? So for 4 level, focus on heat dominated, but for triple burner differential diagnosis, both heat and what? And the damp correlated. So now we need using triple burner theory as differential diagnosis. Not much more easier. So that means which level of conditions involved, in which level, based on differential diagnosis, you know, it's typical what? Damp heat in where? In the lung organ. Upper burner, excellent. Upper burner in the lung organ. So damp heat in the lung organ is typical bronchitis presentations. So that's answer your questions. What's happening after 1 week? They have to change. Either change to problem go to Shaoyang level, 伤寒, or Yangming level, or they have to change the heat, the cold turn to the heat. So for this one, wind cold turn to damp heat. Any questions? If there's no trouble for differential diagnosis, any volunteer would like put the summary of the diagnosis in the whiteboard, in the slides. So unresolved wind cold turned into the damp heat. In where? In the lung organ. The good thing is here has not had serious wheezing. Only start with this kind of bronchitis. If they become pneumonia, that'd be much more severe damage for the lung organ. So here only affect windpipes. Unresolved wind cold turned to damp heat in the lung organs. So for treatment, we don't need treat wind heat anymore. We need what? Eliminate damp heat from the lung. Because they already have a thirsty and it's in autumn. At the same time, clear the damp heat. You also need what? Like we put a note in the treatment, any kind of wound when it shows any dehydration, you need to add what? Add some ingredients, few, one or two, to what? Supply the yin, protect the yin, to rehydrate body yin. Thank you very much. Any formula in it from previous subject study? So 天花粉, some of them mention 天花粉 here is good. Any formula you can name for these cases or herbs, ingredients, put it here. We are all in 4th years now. We should able to have some names, formula, and restored in the brain. 麦门冬天花粉 nourish yin. So there's formula recommended by 养阴清肺汤. 养阴清肺汤. Now because they still have a superficial pulses there, it's a 养阴清肺汤. The best choice, or you need modify from the 养阴清肺汤. So we need it, sorry. So that means diagnosis needs a little bit modifications here. Unresolved, yes, so it's good. Unresolved wind heat turn to the heat, as well as damp turn to the heat in surface and the lung systems, as well as damp heat in the lung organ. So both the lung system in surface and the lung organ internally has been affected. So both and heat, oh my God, wind, dry heat surface, and the damp heat in the internal organs. So 清气化痰丸, 清燥救肺汤, 清气化痰丸, all can be used. And if you modify well with 养阴清肺汤, you need modified quite well, can also be used for these cases. So basically, we need very gentle diaphoretic, remove the remaining dry heat trapped in surface cause of dried nose and thirsty, superficial pulse. Also add the additional one to nourish yin to dealing with dryness, and added damp heat resolving one to clear this kind of bronchitis suffering due to damp heat entered into the lung organs. Is this simple case? Yeah, okay, all right, let's have a look at the second one. Second one is also a young guy, and he actually is one of our former students' brother. Anyway, it happened in 2004. And July in the other side of the world is summer or winter. In Australia, it's winter. In other side of the world is what? Other side of Earth is summer, yes? So he's traveling to Australia from Middle East. So that means from what? From summer, very hot environment, come to very cold, chill Melbourne. So what his complaint is have horrible chills and fever for 6 hours, only 6 hours. And very bad sore throat and swollen throat comes and in 24 hours. You can see such changes so quick. and difficult falling to asleep at night. He came to clinic the day after and accompanied with his sisters. He complains aching all over his body. He feels aching and pain and sweating easily, feeling hot and thirst. So you can see the combination of everything. No appetite, irritability or restlessness with red complexion, and dark yellow urinations, very dry stool, temperatures 38.8. His tongue looks dull red, dry body with thick yellow greasy tongue coating, and pulse very rapid, flooding and slippery in all positions. So first impressions, he's in very good constitution. That's why his pulse had very strong resistance. So this usually indicated people had very good what? Anti-pathogen factors. If the pulse is so weak, gentle, that means constitution is weak. He's very fit. He actually just finished his military duties in Israel. We know people in that kind of the community, they may use some substances, may do not have very healthy dietary, but very stressful environment. So you can use that as a kind of thinking. But most importantly, when we're traveling in the airport, in the airplane, from very hot environment to the very cold environment, and usually we share a lot of beautiful or nasty bacteria in the very confined environment. So in a very hot environment, he must have trapped something when you turn on the air conditions initially. Yes, when you just aboard the airplane, they turn on the air condition in 4 degrees, in a very 4 strengths, and then during the passing halfway, slowly turn a warming and aircon and heating system. When landed to Melbourne, it's very cold, it becomes warm one. But his body, as organic matters, organic structures, are not that fast and easy to adapt with sudden changes still. So what kind of major conditions we can go through it? So initially it's a Shanghai. Yes, it's a Shanghai. Chills and fever, 太阳 division condition. Very simple, or V level condition. And then very straight away, quickly, sore and swollen throat. So when it basically nearly landed to home, it becomes sore. So that means the heat already transmitted, cold is already transmitted it more further, still channel pathology. But when it becomes more swollen here, more severe swollen and sore, and much more severe than chill and fever by itself. People falling to sleep at night, sore throat, or maybe linked with chills and fever. But when he comes to the clinic, why they still have aching on his body? How do we understand this? I remember after I finished the spooning and cupping on his body looks completely black. Coldness trapped when you turn on the aircon in very hot climate. Because you can imagine body is so hot in Middle East. Yes, all your portal is open, you're so hot, you're sweating. Suddenly, you've been trapped in a confined environment in the airplane, in the turn on air conditions. Yes, so that means cold will be trapped and collateral in the surface. This kind of cold has no chance to come out and further invaded inside, result more severe sore throat and more other conditions there. So this still have remaining trapped cold in the collateral surface V level. At the same time, sweating comes out, sweating easily and feeling hot and thirsty. Partially pathogen also penetrate into V level. That's why I feel hot and thirsty, which affected middle gel. That's why it's no appetite, at the same time irritability or restlessness. So more heat dominated with red complexions. Dark concentration urination, further evidence tells your body has been very dehydrated due to heat has over-consuming yin, maybe due to insufficient intaking of body fluid. But the dried stool, further evidence tells us it's just in qi level of the internal or go to organs already. Yang means fu, organ, wonderful. So there's not just remaining 太阳 level division disorder partially go to Yangming Qi level and Yangming Fu organ, so resulting both Taiyang and Yangming disorder. Or from Wenbin concept, it's basically go to upper jiao, middle jiao, lower jiao. Which level? We don't need using Wenbin because there's no damp, but we need using 4 levels: Wei, Qi, Yin, and blood. Which level involved? Wei level and Qi level. Excellent. So Wei and Qi level involved, or Taiyang and Yangming level has been affected simultaneously. So how we're going to resolve this? We also need a diaphoretic, at the same time need a purgative. Da Cai Hu Tang, wonderful suggestions. It's excellent. So Da Cai Hu Tang with both Shaoyang and Yangming disorder simultaneously. And because Cai Hu is good to relieve the temperatures and to enhance perspirations by itself, you still can using Da Cai Hu Tang deal with both Taiyang and Yangming Qi and Fu disorder simultaneous conditions there. So Da Cai Hu Tang can be used for these cases. Now, any questions? How does purging bring the pathogen deeper? Okay. If it's only using purging by itself, yes, it could. But because both of these simultaneously, if you do not resolve dried stool and sore throat will getting worse. If sore throat getting worse, and temperature will be elevated. So you need using reasonable proportions, which formula will be applied for these cases. In the real scenario, he was given by 普济消毒饮. I'll put it here. We did not learn this formula in the formula class. Oh, why did not come out? Sorry. 普济消毒. 普济. Modified. And he received cupping, spooning, a lot of cold. Now even his body looks so black and very dark, bruises comes out, but all the heat, the heat, very strong, old unpleasant, emitted from his body. So this surface trapped by the cold, internally have lots of heat trapped from hot environment he was living before he landed in Australia. And this is internal heat is more dominated, so a little bit of purgative is not going to cause some serious damage. So internally, they can benefit by using the formula of both either 大柴胡汤 or 普济消毒 in a way, and we give him triple doses than ordinary populations. So within 1 week, actually within 3 days, when I saw him in front of the Southern School, I saw him funny. 3 days later, he looks like nothing happening. He can't remember what's happening, like a little baby. It's very funny. And his sister told me about 6 days after finished all the herbs, and he's no suffering left behind. He's completely normal. So that means all the trapped heat he get in the Middle East has been cleaned out. At the same time, he had very good respirations, very good sweatings by taking the formula. Now, 大柴胡汤is used for Shaoyang and Yangming simultaneous conditions. But for this case, there's no Shaoyang conditions. But you still can using 大柴胡汤 for these conditions, which is combination Taiyang and Yangming disorder, or Wei and the Qi level disorder simultaneously. Okay, any more questions for these cases? Yes, you can use Yin-Qiao modified formula with Da Huang. Yes, you can. It's very important, resolve winter toxic heat and also help open the bowel. Yes. Yin-Qiao is very good formula because Yin-Qiao can resolve both weak and qi levels heat. Also can lubricate the bowel. The reason I choose this formula initially for the Puji Xiaodu because I have not seen such people have such a horrible toxicity through spoon and cupping in Australia. So I believe he had too much of toxin in his system. That's why I choose that formula. Okay, one more case study. Now, female 36 years old, an office worker who is under lots of stress and visited clinics or visited in March. So March is still very warm season here. So major concern is anxiety with disturbing sleep in the last 2 months. So it's a chronic conditions. Also, she's feeling burning and fullness and tension in the upper epigastric regions. So glomus, you know that is glomus, yes? Which is worse after meal. Appetite has been reduced a bit. Urine is fine, but her bowel movement is incomplete. Every day period is regular monthly. The tongue is very small in size and with dull red tongue color and pointing on the bright red tips. And coating on the tongue is very thin, dry, yellowish. Her breathing is not very nice, smells. Pulse very rapid, thin, and worried. So this typical glomus condition. Is that right? Okay, there's questions. Do you mean the dark bruises, the cupping marks indicate toxicity? Okay, combination of very dark bruises from previous cases and horrible heat waves, strong odor from his body indicated his body and still have resolved a loss of toxicity. Usually, we all have some odors for our individual living organism. But if the smells is so overwhelming, you can sense, you can feel the wave, kind of vapor of the heat comes through, very strong odor with a black color of bruises after spooning, you know the body contains a lot of obstruction of toxicity. So they don't have good lifestyles to cleansing their system regularly. So this case 3 is typical glomus, is that right? If we finish learning the Sanghanlun, it's typical glomus. But what kind of glomus? So it's not external invasion at all. It's a heat glomus. It's an excessive deficiency. Because the pain is getting worse after eating. Sorry. Burning and fullness, distension feeling in upper epigastric regions, usually related with the hiatal hernia, some level of the some inflammation in the hiatal regions, and they usually have some unnoticeable regular acid regurgitation burning for this kind of patient. It's typical heat glomus. It's mixed of excessive with deficiency, because excessive, the heat excessive, deficiency is what? Is a spleen is deficiency. It's a mixed excessive heat and deficiency in the spleen. So excessive heat in the stomach and deficient in the spleen. So is this Wenbing conditions or not? Is this Wenbing conditions or not? So based on the information given, thank you. It's not Wenbing condition, but if this similar condition happen after party, after eating outside, and also with noticeable elevated temperatures, and you can call that Wenbing, and you can use a damp heat series, so Sanjiao to deal with. Otherwise, you can just don't worry, Wenbing at all. It's typical Sanghanlun glomus conditions. And if it's food contaminations involved, yes, which is much more severe, possible, and abnormal bowel movement, nausea, vomiting involved, yes, it's possible toxic worm invasion regarding to food poisoning, yes. Or a kind of, we call the contaminations from a virus that can cause similar conditions. But because it's 2 months already, so it's not wombing at all. So what formula can dealing with this kind of mixed heat and cold, mixed excessive heat with deficiency, but with heat dominant conditions by using formula you learned in the Classics 1. We're treating her with 半夏泻心汤 with no result at all. So what we should help her by using 大黄黄连泻心汤. 大黄黄连泻心汤 only have 2 or 3 ingredients, and this formula only taken as an infusion. That means using very diluted one. 大黄黄连黄芩 inside formula, and to clear this inflammation happened in the hiatal regions there to help reduce the acid regurgitation, causing burning the pain, and up not 补中益气汤 no. It's not deficiency, it's excessive dominated. 补中益气汤 is too much of lifting, too much of tonification for these cases. He's already had very bad odor from his mouth and noticeable red colors for his tongue and dry yellow tongue coating. This is tonify is not suitable. Is this from accumulation? It is from accumulation, poor lifestyles and stress. Yes. Okay, any questions for this case? All right, now let's have a look some tongue. Oh, I put the wrong one. Sorry. And share. And I mentioned today the one-bean concept. Maybe we do not have a chance using that for very serious one-bean in the clinic. We can use a very mild common cold, influenza, bronchitis, pneumonia-like conditions, but most likely will adopt one-bean concept used for modern conditions applications, and such as skin disorders, some autoimmune disease related, all sorts of other conditions as well, colitis. Once people have typical tongue presentations as a crimson tongue body or skin lesions, shows very big patches of the skin, and that can be used similar like dealing with one-bean. We presented 3 tongue last week. Here have a little bit difference for today. We're going to have 2 additional tongue. Let's have a look. I just find one of the. Okay, what Charlie just put in? I couldn't see Charlie's message here. Anyway, just have a look at this kind of tongue and how we are going to understanding this kind of tongue presentation. What we can see, what we can find. We're all expert now, up to this stage, with so many years brainwash about the tongue and the pulses. And this is also visual, very clearly. Let's have a look what kind of information we can get from this kind of tongue. First impression is that heat, cold, deficiency, or excessive, and channel pathology, organ pathologies. So what is this one? Okay, some people say it's more heat than cold. Some people say it's a watery tongue body. Definitely, it is wet. It is very wet, very tender. So the structure of the tongue is very, very tender. And the more red on the edge, yes, more red and tender on the edge. So there's more pink red, tender. There's a more pink red and tender around the edge. So there's a pink red. You feel this kind of tongue is very soft for you. You can do some damage for them, or you feel the tongue is very gentle and it's very careful to handle. Which way? Soft. So which tells something very important. It's moist, very tender, and tongue. It tells you strong or gentle or weak. So it's not strong. in some way it's typical deficiency. It's a deficient tongue. It's a tender, it's moist, very, very gentle. So tells you constitution is not strong, presented by the tongue. Now, is it heat dominated or cold dominant? Depends how do you interpret this kind of tongue. The redness. Do you call this is a red tongue or pink red tongue? Pink. So pink red. So either pink or pink red. But it's not red red, yes? So pink red, either normal or heat. If it's a heat, it's an excessive heat or deficiency heat. More deficient heat, because we mentioned the tongue looks so tender, we need to handle it gently. So moist, tender, excellent. So basically, there's a deficient heat involved, and with insufficient qi due to moist of the tongue and the tender around the surface. Now, any of you see the dent at the beginning here? Oh, I couldn't see that. Color, different color. Uh-oh. I'm just a bit exaggerating. Any see the dent at the tip? Yes? Yes, 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 you can see that one. Okay, so that means you can basically see right side of the tongue body, little bit bigger, but deviated in a way from the left. Sorry, my drawing is so bad. Slightly, but definitely right side is thickening, more thick than right, yes? So what that means is the right side of the tongue thicker than the left side. We discussed last week. Means what? If the right side of the tongue is more thicker than left side, means what? Trouble with descending, excellent. So that means the bowel is not able to empty it completely, regularly, or sufficiently, and they don't have good function of stomach's qi and the gallbladder secretions. Excellent. So clean that up. Now, the surface of the tongue looks smooth or not smooth. So if you drive the car on top of surface this kind of road, your car is going to bumpy. Yes? Okay, why the surface road can be bumpy? Due to what? Either they have a stone or they have a root of the tree or vegetation causing bumpy of the road, yes? In the country road, yes? So that kind of embedded stone and of the root, it tells you congestion, some congestion. Now the congestion in TCM is caused by congestion heat based on the overall color of his tongue. So this kind of congestion, if it's present in the whole tongue, could be flame and damp. If it's uneven surface, it's typical congestion heat due to long-term liver qi stagnations. So bumpy on surface, on smooth surface. So present overall as red dominated with deficient heat is congestion heat. So this kind of congestion due to long-term liver qi stagnation. Now, any of you see the tinge of purple on the part of the tongue body? Could it be inflammatory for liver stagnation? Yeah, all this congested heat, it is due to liver qi stagnation. So this congested heat, it does relate with dysfunction of liver. Thank you. Now, any of you see specific tinge of purple or a little bit dark color of the body? Or that means you can see through color of the veins, yes? Which part you can see through color of the veins? Some coldness trapped inside, but this part may be due to color of the made image slightly different, yes? And so you can see possible coldness in the middle gel here due to an unevenly distributed tongue coating and the color from underneath. So this is unevenly distributed tongue coating indicator what? We learned from last week, means what? Water qi is stagnated, resulting in poor distribution of stomach's qi. So if the tongue coating are not symmetric, evenly distributed, is a liver qi stagnation, which is not able to supporting stomach's qi. So this basically, yes, there could be stomach qi deficiency, but in general, it's the liver qi not very well smoothly flow. So liver qi stagnation, which tells you resulting bumpy road, have congestion heat inside, resulting thickening on the right side of the tongue body, and also discussion liver qi affect the stomach qi, resulting uneven distribution of tongue coating. Now let's have a look at the quality of tongue coating. Is tongue coating looks dry for you, or moist or greasy? The difference between moist and greasy is moist is still noticeable. You can see tiny structure. If the greasy, all the structure of tongue coating has been fused. Somebody says tongue coating is dry, and somebody says tongue coating is dry. Okay, now because this image is not as clear as they should be, but based on fused tongue coating, you can see this tongue coating. Can you see this tongue coating fused together? Yes, so this is very greasy, but it does have a crack. Okay, I'll use red to indicate cracks. Tiny cracks. So there's a combination of greasy tongue coating with dehydrations. And on these multiple lines of cracks, further evidence tells us they have unresolved congestion heat cause this kind of body fluid injury. Now, how do we understand this? It's a dent, it's not crack. What that tells us? Deficiency. Excellent. So what organ involved? So either generally spleen qi deficiency, heart qi deficiency regarding muscles dent, or liver's yin is insufficient, not able to fill the gap of the blood or these locations there. So miao qi is weak. That's why result that thick, greasy tongue coating, uneven distribution of tongue coating, and also have stomach insufficiency due to congestion heat, and with long-term liver qi stagnations and liver heat constraint or congestion liver heat. This specific green part circle indicated spleen is weak, not able to generate sufficient liver yin or liver blood. Now, the tongue itself does not indicate very serious illness, but tells you a lot of imbalance has been occurred from past, accumulated, build up these kind of imbalances. Now, any of you see that? So what kind of correlation with organs for the body? Lung. Yeah, okay. They may have some sputum related in upper gels. So either very easy have mucus in the throat, or very easy have discharge from the nose, or very easy to do this cleanup in the morning. So this is a possibility what comes out because they have some shape changes here. I just changed different color. Can you see this kind of shape protrusion here, like this? Of course, this covered all these areas now. Yeah. So they have some imbalance between yin and yang. So we still call the bumping road. But based on specific organ correlations, yes, this is related with specific organ of the lung part. The lung part have excessive obstructions. Middle gel spleen is depleted, dominated, and with damp cold accumulations. So this is one way with very brief cleansing of the tongue, and we are able to achieve to do that one day, maybe now already. And the heart, based on this kind of dent at the tip, yes, I'll check the heart and we're careful about heart. From my slides here, looks like color a little bit changes around the tip here. So there may have been rapid heart or something representing the pulses there. So I also need to check the heart as well, especially with the dented tip here. They may have heart insufficiency and some functional changes there to cause these structure changes. So this is part of the things we can learn from the tongue diagnosis, not just in Wenbing, but specific, because we emphasize Wenbing application for tongue, for generally internal med differential diagnosis, gynae, skin conditions when you go for the teleconsultations. Now, any question for? If any of, can I? Yes, you can. And any of you are welcome to leave if you need to go, and also welcome to stay, and if you stay. On top of this, if you can see little color of the lips here, is the lips normal color for you to look at it, or a bit more dull? If the people's over 50, it's quite common for this kind of color. If the color in young age, we know this color will be much more dull, maybe some either lack of nourishment or congested. And I cannot indicate the main complaint. We only try to understanding the tongue differential diagnosis in a way to help us go through, yes, exercise for the tongue readings. Yep. All right. Thank you. Now let's have a look at the next one. How long does it take up to build up? Some people takes many years, some take few weeks. And if somebody have serious trauma and tragedy, they can go very quickly. Why is there only a dent on one side? Yes, the typical serious obstructions dominated on the one side of the body. They have lots of obstructions here. There's no way we're causing any weakness to show on the right-hand side. If it's symmetric, both sides dented, it's more serious for deficiency. If it shows one side dented, other side is no dented, shows deficiency, not as severe as a symmetric one. Does that mean heart structure problems from murmur? Possibility, because we only focus on qi basic as a qi understanding, basically, to result in some physiological changes. Regarding to Western diagnosis, we don't have that qualification to go through that. Thank you. Have a look another one. What's the difference between previous ones? So what we can see from this. So previous one is not typical Wenbing tongue, yes? How about this one? It's not Wenbing tongue at all. Big, white, good. It's much more white, so more thick than previous one, more white. And scallop, teeth, and age, yes, more redder on the tongue tip, and more dehydrated overall, because not as moist compared with previous one. That shows more slightly yellow dent of tongue coating. You can see a little bit of yellow dent and gray here, with multiple tiny crack horizontally. And also image of quality of image is not as good. So why hard qi deficiency? There's a lot of redness comes and the dots correlated with teeth marks around the edge and the tip. So why there's hard qi deficiency? Have a look. Maybe we can help understanding altogether. Look at the side. No tip. This is still tip. This is still tip. This is still tongue tip. Just more round and smooth. The side of our tongue, not as red as the previous one, isn't it? More paler here. So as a female, they may have some level of liver blood deficiency. Post-menopause is quite common. But looks like here side is much more paler. More paler on the side for these clients, but much more red at the frontal part and edge. Much more red on this frontal and side here. And not pointing, left side red than the right side, maybe, but not much of swollen on the right-hand side compared with previous one. But this one had very big dent at the front. Oh. Okay, I'll clean up first. Can everybody see this big dent at front, frontal? We can see big dent at the frontal, and middle gel here, they have a tiny horizontal crack, and dehydrated tongue coating slightly yellow grayish. So that means middle gel have lots of possible hard ink deficiency. That's why I have tiny multiple cracks with dehydrated tongue coating all over, evenly distributed and slightly yellow. On the frontal part, we can see noticeable dent. This kind of dent is correlated with tip and edge redness. It shows structure yin is insufficient in the lung and possible heart here. Oh, sorry, previous tongue concern was the left side up epigastric discomfort for the previous tongue. And this tongue main concern is much more easy, frequent perspiration during the day and the night. So this one have no noticeable damp presented on the tongue, but more qi deficiency, like some of you already indicated, by presented teeth marks around the whole tongue tips and flat tongue bodies, with additional dent in the middle part here, tells the lung and the heart qi or yin is insufficient, which is very easy, have a sweat and matched with her basic complaint, with redness on the tongue tip indicated more noticeable and severe or complaint of sweating at night, causing disturbing sleeps. So this is kind of common conditions we can see clinically. They do not have an uneven distribution tongue coating, no bumping road, and no serious swollen on the right side of her tongue. So this comparison for both of this tongue. And is there more lung areas? Middle is a little further back. Yeah, this is middle gel here. Middle gel is here. So here, messy part of drawing is a lung. Yeah, frontal part is more hard. Yes. Now, by comparing these two tongue image, you can see big difference. Which one have bumpy surface or uneven surface? Which one have a symmetric distribution of tongue coating? So still first one. And which tongue is much more redder than others? First one. And the first one's redness is look like fresh red or dull red. So you need to see underneath the colors here. So you may need to check the sublingual veins after checking the frontal part that give you answers. When sublingual veins shows a lot of bulging and enlarged veins, dark one, they indicated or help you understanding why the color at the frontal part red is not as fresh as they should be. And how do you describe the second image of tongue color redness, the redness here? How do you describe it? As a pale pink or pale or dull red? So more dull red at the frontal, more pale red at the pink on the side. So for this one, so first one you can see maybe it's a male, sorry, because this body hairs go through. Second one looks like female, so basically on different focusing. And it's easier for the female, have blood deficiency. For the male, very easy, have liver qi stagnations, liver blood stagnations. And based on the age, if second image is after menopause, very easy to have liver blood and liver yin deficiency with hyperactive heat. For the first one, if it's also over middle age or for old people, and they may have some level of liver blood stagnations, weak spleens, qis. Now, any more questions for these two tongue image? And what does a broad tongue mean? Broad tongue based on the size of a tongue, based on the size of the face, and then we are going to assess is it broader or narrow. So these clients have broader tongue in general. See? So as a kind of comparison digits, they are going to suppose have relatively size the tongue. So still we call this broad size of tongue. because the thickness of the tongue still good in the size, we do not call that gene deficiency. If the broad tongue correlates with a very, very thin tongue body, we call the gene deficiency, or constitutional gene weakness, insufficiency, and qi deficiency as well. And there's a question, why does the frontal dent of the second tongue indicate indeficiency? And what forms the structure of the tongue? Is it qi or yin? Structure of the tongue is formed by the blood, yes? So that's why we call it indeficiency here. Because the frontal part of the tongue body is also red. Yes, thank you. Same for the first tongue, you can say some level yin or blood deficiency indicated by here for the first tongue. It's possible to have some level blood or yin deficiency because based on proportion, they only take very small percentage. It's not serious. There's another question, does the first tongue, the coating is even or uneven? First tongue coating is uneven. That's why I indicate liver qi stagnation. And the frontal part, the tongue coating, is much more even for the first tongue coating. But the overall tongue coating for the first tongue body here is not even. It's uneven distributions. Thank you. Any more questions? What do the first tongue shining parts indicated? More shining tells you it's more tough or more tender. More tender, yes. So that usually shows some qi weakness involved. But if it's caused after bitten the tongue, that's different. That's injuries caused of local structures changes and blood stagnations. As an adult, more tender your tongue looking, more weak constitutions in the middle gel. Because we are not baby anymore. Baby is supposed to have tender tongue. When it become matured, part of tissue. When it become matured, part of tissues as a tongue should look like matured tongue as well. If it looks tender, that relevant qi is insufficient, or from the injuries, like a newly grown of the tissues after injury of the tissues, and all looks very, very tender. But after years recovering, they become matured and not more tender anymore. Now, if there's no more questions, and all done for today, and thank you very much. And if you have any concern, and send emails to me, we can have discussions. Yeah, I will send the link for you for the ACMAS one. Thank you very much.